Recognizing the telltale signs of an addiction to this opiate may help a loved one get much needed treatment. Part 1 of 6. Overview Why heroin addiction may be difficult to speak about with a loved one. People who suffer from addiction are frequently not honest about their substance abuse. However, discussing heroin addiction could be a life-saving conversation. In order to discover the truth and really understand the depth of the problem, you may need to be a bit nosy. Identifying the signs of heroin addiction can be the first step toward your, or someone else's, recovery. Part 2 of 6. Evidence of heroin addiction. Understanding the devices a person needs to use the drug and what it actually looks like can help you identify heroin use. In most cases, a heroin user needs certain paraphernalia items in order to actually consume the drug. Heroin can be injected, snorted, or smoked. Needles, pipes, and spoons with lighters are often used. Damaged veins are difficult to inject, so some addicts need to use rubber tubing or elastic bands to make their veins larger. Heroin itself is a powdery, crumbly substance. It's often off-white, but its color can range from white to dark brown. Black tar heroin gets its name from the way it looks. This type is a black, sticky substance. Part 3 of 6. Symptoms of heroin addiction. Symptoms of heroin use occur rapidly. A person who injects the opiate will experience a drug-induced euphoria quickly, often within seconds. Other means of consuming heroin do not produce a reaction quite as fast, but users will experience obvious signs as soon as the drug reaches their brain. Physical signs of heroin use include dry mouth, flushed skin, constricted pupils, falling asleep suddenly, slow breathing, loss of self-control, itching, nausea and vomiting, constipation. Signs of heroin use that are not as visible include a feeling of heaviness, confused thinking or disorientation, difficulty making decisions, memory loss. People who use heroin often regularly need laxatives or stool softeners because heroin can cause constipation. Additionally, heroin damages a person's immune system. An addict may suffer regular and frequent infections because their immune system cannot fight off invading bacteria. Part 4 of 6. Lifestyle changes caused by heroin addiction. Heroin addiction may be hard to identify at first. Over time, however, the addiction becomes more real and all-encompassing. A person who is addicted to heroin will soon worry more about getting their next dose than almost anything else. Heroin injections cause needle marks, so many addicts wear long-sleeve clothing year-round in order to hide their scars. Fearing their addiction will be revealed, heroin addicts may become withdrawn from friends and family members. Social and personal isolation is common among addicts. Work and personal relationships may also suffer. An addict may also have trouble with health and personal hygiene. Part 5 of 6. Complications. Medical effects of heroin addiction. Heroin is a powerful opioid that can cause dangerous complications. Sometimes these complications can be life-threatening. For example, heroin use can cause miscarriage. Some people may contract infectious diseases from needle use, such as HIV and hepatitis. A fatal overdose is also possible. Long-term heroin use damages organs, the brain, and the skin. Addicts may develop kidney, liver, or heart disease because of their drug use. Additives in heroin may coagulate or clot blood vessels and veins. This can lead to strokes and permanent organ damage. Some additives are deadly and can kill a person within minutes. Unfortunately, it's often impossible to tell what has been mixed with heroin unless you conduct tests. Many illegal drugs, such as heroin, are laced with dangerous substances that are only identified after a tragic accident. Babies born to heroin addicts are often underweight. If the mother is using while pregnant, the baby may be born physically addicted to heroin, too. If this happens, the child may experience neonatal abstinence syndrome. The infant will need to detox and go through withdrawal after birth. Part 6 of 6. Getting help for an addiction. If you're addicted to heroin and need help, reach out to a loved one or a doctor you can trust. They can help you find treatment facilities, medical help, and addiction experts who can help you get clean. The first step to getting better is admitting you have a problem. Kicking your habit may not happen the first time you try it. Some people require multiple attempts before it finally lasts. However, determination and dedication can go a long way to helping you and the people you love heal and move toward a happier, healthier life.